Now, let's move on to issues of mental health. The South African Society of Psychiatrists recently held a congress on the state of mental health in the country. Now, we are nearly into the festive season, and of course, this period often gets too intense for those who suffer from a variety of mental disorders. So how does one cope during this time of the year, and what role does primary health care play? And currently, what are the trends really are we seeing in the country regarding the problem of mental health? Let's unpack all of these and more with Dr. Sandra Fernandes from the South African Society of Psychiatrists. She's a member of that, but she's also Wits University's Divisional Head of Neuropsychiatry. Her day job is as a Tara Hospital here in Sandton in Johannesburg. Doctor, good afternoon. Welcome. Thank you very much for coming through.
Thank you, Rodan. Thank you for having me.
You know, almost all the time, around this time of the year on eNCA, we try and talk about the stresses because it can be a very lonely time, festive season, and very stressful time, festive season. But I was asking myself, what would be the most important question to ask you today? To say, what is this question that we need to be grappling with? Because the pandemic has exacerbated the situation. Not that there were no mental health issues pre-2020 when we became under lockdown, but it got worse.
Yes.
And post it, it looks like we're still battling.
We are. So I think certainly South Africa has high rates of mental illness. And for various reasons, we are a developing country. We also have significant high levels of unemployment, high crime rate, people still living in dire conditions, poverty, etc. And all these have a significant impact on people's mental health well-being. So we have high rates of depression, anxiety, suicide, post-traumatic stress disorder. You know, adolescents, you speak about this particular time period